Here are the topics that I will be explaining to you thoroughly from A to D. So, in letter A, we have dental radiology and infection control. B, occupational health and safety. C, infection control and special situations. And letter D, emerging trends in infection control. Now, I'm going to let you see the pictures that we took during our röntgenology, which is a dental radiology subject. So, on the first pic, the operator, which is my partner, LOANZON, is taking bisecting technique with me. So, she's wearing complete PPE as well as the patient, which is Jenica, me. And on the second pic, the dark room is organized and people are patiently waiting for their turn to develop the film. And on the last picture is each dental practitioners are practicing safety practices in the exposure room. Let's know dental radiology and infection control together. Letter A, the relationship. To control and avoid contamination of pathogens to the people present in the setting. Example is wherein we place the film inside the patient's mouth, and it is very important that us being operators we place gloves or PPE so that we can avoid any risk of transmission. Letter B, radiology infection equipment. This is crucial to ensure the control of infection inside the dental clinic. These steps also help to minimize cross-contamination and preserve the equipment's accuracy and performance. In this situation, we can talk about the scenario inside the dark room. Inside the dark room where developer and fixer is placed. So, those two solutions, there are two separate bowls so that the film would develop properly and nicely. It won't get cross-contaminated. So it also needs to be organized so that we have better results. Letter C, infection control measures during dental radiographic procedures. This is crucial to employ appropriate infection control measures during operations as this support treatment planning and diagnosis. Letter D, handling and storage of radiographic films and digital films. To preserve these quality and integrity as well as to guarantee infection control in dental office, proper handling and storage procedures must be followed. So along with the developing, fixing stuff, we must also place it in a proper storage wherein we have the dental film cover to protect all the x-rays. Occupational health and safety. This is important as let's talk about the hazards in dentistry and the measures in infection control. We have the 4 classifications, which are bloodborne pathogens, chemical hazards, radiation hazards, and musculoskeletal injuries. So in bloodborne, it talks about contact with blood or other infectious materials. And here are ways to minimize this. So firstly, we must have standard precautions. Second, hand hygiene. Third, safe needle practice. And fourth, hepatitis B vaccination. On the chemical hazards, this involves the use of chemicals like disinfectants, impression materials, and other laboratory materials. Proper ventilation, chemical handling, labeling, and storage, material safety data sheets are important in order to ensure safety. In radiation hazards, it talks about the radiographic procedures may be exposed to ionizing radiation. To minimize such radiation hazards, radiation safety training is a must. Personal dosimeters, equipment maintenance, and regulatory compliance must be followed. Lastly, musculoskeletal injuries. Here, it is physical demands of dental procedures and patient care. So to prevent injuries, ergonomics, patient positioning, teamwork and assistance, training and awareness must be done in order to have a safe practice dental procedure. Section 10.2, Prevention of Sharps Injuries and Experiences. Number 1, safe handling of disposal of sharps. We must use safety engineered devices, avoidance of recapping, proper disposal containers, and one-handed technique. Number 2, personal protective equipment. Wearing of appropriate gloves, eyewear, and face shields, including protective clothing such as aprons and gowns. Number 3, training and education. Sharp safety training, standard precautions, and post-exposure protocols are given. Number 4, engineering administrative controls. Work area design, sharps injury prevention programs, and reporting and documentation are its classification. Number 5, vaccination and health monitoring. It is important that we have hepatitis B vaccination and health monitoring. These are important as sharp injuries and exposure incidents pose an important risk to dental healthcare personnel in dental clinic. It involves potential exposure to bloodborne pathogens. Therefore, implementation of appropriate measures to reduce risk is essential. Section 10.3, vaccinations and immunizations for dental healthcare personnel. So these must be followed. Hepatitis B vaccination, influenza vaccination, tetanus, diphtheria, and pertussis vaccination, measles, mumps, rubella vaccination, varicella vaccination, and other vaccinations must be complied in order to have immunity to the personnels. Infection control in special situations. Section 11.1, infection control during oral surgery and dental surgery. These procedures often involve invasive intervention, increased exposure to blood and saliva, and higher risk of cross-contamination. Implementing appropriate infection control measures is essential to minimize the transmission. So here are the steps. Pre-operative considerations, personal protective equipment, instrument sterilization, disinfection, environmental controls, post-operative considerations, and emergency preparedness. Section 11.2, infection control considerations for pediatric dentistry. So this is unique as this talks about the vulnerabilities of children. Dental healthcare personnel must employ specific measures to ensure the safety and well-being of pediatric patients while providing high-quality dental care. So these are the following: communication and education, prevention of cross-contamination, behavior management techniques, PPE and occupational safety, environmental controls, and post-operative care. Section 11.3, infection control and orthodontics in other specialized areas. These are general dental practice, specialized areas such as orthodontics, as it requires specific infection control considerations. This involves prolonged contact with patients, use of specialized instruments, and unique treatment. So in order to have infection control measures, it is important to maintain a safe environment for both patients and dental health care. So we must consider the following. Firstly, we have patient assessment and communication, personal protective equipment, instrument and equipment management, environmental controls, post-operative considerations, and orthodontic laboratory procedures. Emerging trends in infection control. We have new technologies and advancements. Dental clinics' infection control procedures are always changing in response to technological breakthroughs. In order to stop the spread of diseases and keep patients and dental healthcare professionals safe, these innovative technologies provide enhanced efficacy, efficiency, and convenience. Second, antimicrobial stewardship in dentistry. A strategy to maximize the use of antibiotics in order to decrease the formation of antibiotic resistance and lower the likelihood of unfavorable outcomes is known as antimicrobial stewardship. Although antibiotics are essential for treating dental infections, it is important to use antimicrobials responsibly in dentistry. It assists maintain the efficacy of antimicrobials and guarantee patient safety. UVC disinfection systems. It uses ultraviolet light with a specific wavelength, typically around 254 nanometers. It is to kill or inactivate microorganisms. These systems are used for disinfecting surfaces, equipment, and even the air in dental clinics. UVC disinfection can be a valuable addition to routine cleaning and disinfection protocols as it provides an extra layer of assurance. Number 2. Automated hand hygiene systems. These provide a touchless and efficient way to ensure proper hand hygiene compliance among DHCP. These are often sensor-based technology to dispense the appropriate amount of hand sanitizer, hand washing solutions that promotes consistent and effective hand hygiene practices. Number 3. Antimicrobial surface coatings. These are substances with antimicrobial properties such as silver ions or quaternary ammonium compounds into the materials used for dental surfaces and equipments. These coatings help inhibit the growth and spread of microorganisms on treated surfaces, reducing the risk of cross-contamination. Number 4. Single-use disposable devices. These are used to eliminate the need for cleaning, sterilization, and reprocessing, reducing the risk of cross-contamination. Many dental instruments and devices such as syringe tips, saliva ejectors, and air-water syringe tips are now available in disposable formats, ensuring high level of infection control without compromising the convenience. Number 5. Sterilization monitoring technologies. These enhance the monitoring of sterilization processes in dental clinic. Chemical indicators that color change when exposed to specific sterilization conditions, integrators that provide a more comprehensive assessment of sterilization parameters, and biological indicators that use highly resistant microbial spores to validate sterilization effectively. Number 6. Digital documentation and record keeping. This streamline infection control protocols by providing a centralized platform for managing patient information, treatment records, and infection central logs. Number 7. Air filtration and purification system. These control the spread of airborne pathogens and aerosols in the dental clinic. These systems incorporate high-efficiency particulate air filters, activated carbon filters, and sometimes even UVC technology to capture and neutralize microorganisms and other contaminants from the air. Number 8. Teledentistry and virtual communications. This gained prominence especially in the light of the COVID-19 pandemic. Technologies allow for remote consultations, triage, and patient evaluations, reducing the need for in-person visits and minimizing the risk of disease transmission. Lastly, 3D printing for customized devices. These are examples like surgical guides, models, and prosthetics. This technology enables for fabrication of precise and patient-specific devices, reducing the need for extensive adjustments and potential contamination associated with traditional manufacturing methods. Section 12.2 Antimicrobial Stewardship in Dentistry. This talks about coordinated approach aimed at optimizing the use of antimicrobial agents to minimize the emergence of antimicrobial resistance and reduce the risk of adverse events. While antibiotics play a vital role in treating dental infections, it is crucial to practice responsible antimicrobial use in dentistry. Implementing antimicrobial stewardship principles helps preserve the effectiveness of antimicrobials and ensures patient safety. So here are the following to consider. Number 1, appropriate prescribing practices. Second, culture and sensitivity testing. Third, prevention and infection control. Fourth, patient education. Fifth, collaboration and communication. Sixth, monitoring and evaluation. Section 12.3 Current Research and Future Directions in Infection Control. Infection control in dental clinic is a dynamic field that continuously evolves based on scientific research and technological advancements. So here we have antimicrobial resistance, where its goal of research is to reduce antimicrobial resistance by developing techniques to understand its mechanisms, entailing examines of frequency and trends of antibiotic resistance in oral infections, looking into substitute antimicrobial agents and testing therapeutic approaches such as antimicrobial peptides. Secondly, biofilm control. As we all know, biofilms are intricate microbial communities that grows on variation. So this consists of microorganisms embedded in an extracellular polymeric substance that they have generated on their own. So because of this resiliency to immunological reactions, antimicrobial treatments, biofilms are difficult to regulate and eliminate. So the goal of biofilm control research is to create methods for stopping the growth of biofilms, dismantling those that already exist, and improving effectiveness of antibiotic therapies. Third, surface disinfection. Surface disinfection is essential for infection prevention because surfaces can harbor different microorganisms and aid in the spread of infectious illnesses. Developing more effective and efficient techniques to eradicate microorganisms and lower the risk of diseases linked to healthcare is the goal of ongoing research. So these are important: evaluation of disinfectants, disinfectant formulations, novel disinfection technologies, surface coatings, automated disinfection systems, adherence to disinfection protocols. Lastly, aerosol management. These are improved aerosol management techniques in dental setting, continuing the study due to the growing awareness of aerosol-mediated, involving examination of effectiveness of suction devices, high-efficiency air filtration systems, and aerosol-reducing methods during dental treatments. In healthcare settings, aerosol-generating operations can contribute to the spread of infection diseases, so it is important to control the spread. Understanding the production, transmission, and mitigation of aerosols, as well as creating tactics and technology to lessen, is important. Personal protective equipment. This research aims to enhance the design of effectiveness of PPE to provide better protection for dental healthcare personnel, including the study of the performance of different types of masks, face shields, and protective clothing, as well as exploring innovative materials and technologies to improve comfort, breathability, and barrier properties. Waterline management. Water lines in dental units can harbor biofilm and potentially contaminate dental unit water. Current research focuses on developing improved waterline treatment protocols, including the use of antimicrobial agents, filtration systems, and monitoring techniques to ensure the safety of delivery and high-quality dental unit water. Point-of-care testing. Researchers are exploring the feasibility and utility of point-of-care testing devices in the clinic to facilitate rapid identification of pathogens and guide appropriate dental treatment decisions. These can help develop the diagnostic tools for detecting oral pathogens and assessing antimicrobial susceptibility quickly and accurately. Examples are rapid diagnostic tests, pathogen identification and antimicrobial resistance testing, influenza and respiratory infection testing, sexually transmitted infection testing, remote and mobile POCT, biosensors, and novel technologies. That's it. Now we're done with A, B, C, and D. Now let us have Millicent to discuss the rest of the letters so that you will know the importance more of infection control in dentistry.
Now, come along with me as I tackle infection control audits and compliance, training and education in infection control, and case studies and best practices. Infection control audits and compliance. First, we need to define audits. These are the compass that guides the dental practice towards the north of safety and compliance. They serve as a systemic examination, ensuring that infection control protocols are not only in place but are also followed meticulously. The importance of audits. They validate the effectiveness of existing infection control measures. They identify potential breaches or lapses in protocols, providing an opportunity for a timely rectification. Regular audits reinforce a culture of compliance and accountability within the dental practice. Guide to conducting effective audits. First, understand regulatory requirements. Familiarize yourself with relevant regulations and guidelines issued by organizations such as the Centers for Disease Control and Prevention, Occupational Safety and Health Administration, and the American Dental Association. These guidelines will serve as the foundation for your audit criteria. Second, establish audit criteria. Develop a checklist or audit tool based on the regulatory requirements and best practices specific to dental infection control. Include key areas such as sterilization procedures, personal protective equipment or PPE usage, environmental cleaning, instrument handling, and patient management. Third, regular audits and select competent auditors. Regular audits are essential for maintaining infection control in dental practices, with quarterly or semi-annual audits being standard, though frequency can vary based on practice size and complexity. Assigning competent individuals to conduct these audits is crucial. They should possess a deep understanding of infection control protocols and be capable of objectively assessing compliance. Fourth, pre-audit preparation. Notify staff about the upcoming audit to ensure readiness and cooperation. Gather necessary documentation such as infection control protocols, training records, and equipment maintenance logs for review. Fifth, on-site audit process. During the on-site audit, assess cleanliness and adherence to infection control protocols using a checklist, inspecting sterilization areas, water lines, and consumables. Interview staff to gauge understanding and identify training needs for improved compliance and safety. Now, let's proceed to the application of what we have learned. Sixth, document findings and providing feedback, highlighting areas of compliance and requiring improvement, noting any deviations from established protocols and regulations. Debriefing session with the dental team to discuss the audit findings, acknowledging areas of compliance and commendable practices. And lastly, addressing deficiencies constructively and providing actionable recommendations for improvement. Seventh, develop corrective action plans. Collaborate with staff to develop corrective action plans for addressing identified deficiencies. Establish timelines and responsibilities for implementing corrective measures. And lastly, follow up and re-audit. Monitor progress on corrective actions and conduct follow-up audits as needed to ensure sustained compliance. Use these follow-up audits to track improvements and identify any recurring issues. Training and education in infection control. Why is it significant? As dental professionals encounter a variety of challenges, including new pathogens and evolving technologies, continuous education becomes essential to maintain effective infection prevention measures. It instills confidence in patients, knowing that their care providers are well informed and competent in managing infection risks. Ongoing education fosters a culture of safety and excellence, ensuring that dental practices not only comply with current standards, but also proactively anticipate and respond to future developments in infection control. Now, here are the creative methods for keeping the dental staff updated on best practices. First, we can conduct interactive workshops and simulations to provide hands-on training and practice infection control procedures. Second, utilize multimedia resources such as videos, webinars, and online courses for flexible and accessible learning. Third, implementing peer-to-peer learning sessions or lunch and learn sessions to facilitate knowledge exchange among staff members. And lastly, inviting guest speakers such as infection control experts or regulatory agency. And lastly, inviting guest speakers such as infection control experts or regulatory agency representatives to conduct specialized training sessions. Next, I will be presenting real-life case studies illustrating successful infection control measures. First, we have here implementing sterilization protocols. A dental practice experienced an outbreak of infections among patients. Investigation revealed that there are lapses in sterilization protocols. The practice revamped its sterilization procedures, ensuring adherence to CDC guidelines. This included routine maintenance of sterilization equipment, proper packaging of instruments, and regular monitoring of sterilization cycles. Staff underwent retraining, emphasizing the importance of meticulous sterilization practices. As a result, infection rates significantly decreased, restoring patient trust. Next, we have enhancing hand hygiene compliance. A dental clinic faced recurrent cases of cross-contamination despite established hand hygiene protocols. The clinic introduced a multifaceted approach to improve hand hygiene compliance. This included installing visible hand hygiene stations throughout the clinic, providing continuous education on proper hand washing techniques, and implementing regular audits to monitor compliance. Staff were encouraged to hold each other accountable, fostering a culture of diligence in hand hygiene practices. Consequently, there was a notable reduction in cross-contamination incidents. Now for our last case study is a dental office identified environmental contamination as a contributing factor to infection transmission. The best practice here is that the office implemented rigorous environmental cleaning protocols, including the use of EPA-approved disinfectants and frequent sanitation of high-touch surfaces. Additionally, the waiting area layout was modified to minimize patient contact with contaminated surfaces. Staff were trained to identify potential contamination hotspots and instructed on proper cleaning techniques. Subsequently, there was a significant decrease in infection transmission, enhancing patient safety. So here are the best practices derived from case studies. Regular training and reinforcement. Continuous staff education and retraining on infection control protocols are essential to ensure compliance and mitigate risks. Adherence to guidelines. Strict adherence to established guidelines, such as those provided by the CDC and ADA, is critical for effective infection control management. Culture of accountability. Foster a culture where all staff members feel responsible for infection control practices, encouraging peer monitoring and support. Utilization of technology. Implement technological solutions such as automated monitoring systems for sterilization cycles and hand hygiene compliance to enhance effectiveness and efficiency. Patient management. Educate patients on infection control measures and involve them in the process, empowering them to advocate for your safety. That is all for today. We hope that you learned something from us. Thank you for watching.